I'd like to welcome all of those viewers to the Bunbury and Eaton Vet Clinic's question and answer session on dental disease and dental care in dogs and cats. I'm Joe, one of the practice partners for the Bunbury and Eaton Vet Clinics. And our topic of conversation today is canine and feline or dog and cat dentistry. As an introduction, the importance of dental care in dogs and cats has gained more and more attention of late in recent years, having more of a scientifically proven effect on the longevity of pets and their life expectancies. I guess, you know, we recognise dental care along with things like quality nutrition, improved infection control, also early disease detection as being things that have made a big impact on dog and cat's life expectancy, you know, in the last couple of decades, and things continue to improve there. So it's not unusual to have small breed dogs and cats living through into their early 20s these days, and for big breed dogs to be living well into their teens. So what we I guess recognise then is that dogs and cats with dental disease that's deteriorating with time have been proven to have an increased risk of microscopic damage and bacterial toxin damage to their liver, kidneys, heart valves, which can ultimately contribute to end-stage disease or organ failure later in life. That periodontal disease, it's a plaque-induced disease. So the teeth initially will have plaque accumulations, which are caused partially by bacteria, partially by the food byproducts that are attached to the teeth, and then also by the body's secondary, inflammatory responses that come secondary to those accumulations of plaque and food. So, arguably, it's one of the most common diseases that we see in general practice today. A large proportion of adult dogs and cats have some degree of periodontal disease during their life, and because of this, our clinicians include a mouth and teeth or oral examination as part of every routine examination to just try and pick up on this as early as possible, so that we can try and try and prevent it. Definitely, prevention is far better than trying to cure it. If it's picked up very early in the piece, when there's just early gum inflammation, and the right steps are taken, we can turn it around and definitely reverse the damage that's been done. But once more advanced damage has happened to the attachments of the teeth into their sockets, definitely it becomes a process that's harder and harder to reverse and may become irreversible, ultimately heading pets down a one-way street towards loss of teeth and severe dental disease. So the risk factors that we identify with regards to dental disease, definitely accumulation of plaque is a strong indicator that the disease is underway. Overcrowding of the teeth especially in our smaller patients' mouths, so small breed dogs and some breeds of cats. Definitely the dogs with a shortened snout and cats with a shortened snout. So your bulldog breeds, Persian cat breeds, some of your Shih Tzu and Maltese type breeds, their shortened dental arcade or their shortened jaw crams the same number of teeth into a much smaller space, so they tend to be a little bit skew-if, and end up having overcrowding and malocclusion issues because of that. Sometimes we see, in some animals, retained baby teeth. So instead of the adult teeth erupting and pushing out the baby teeth end up remaining and causing overcrowding, because you've got a doubling up of the teeth that are meant to be in a particular place in the jaw. We do see sometimes abnormalities in the amount of saliva that's produced, but that's probably, there's not a huge amount that we can do with that. Definitely certain disease conditions can contribute to that. Things like diabetes can reduce the amount of saliva production, and some of the other things that we see, diet type definitely, has got a close association with, potentially exacerbating and causing more rapid accumulation of plaque. Definitely food that is sticky promotes plaque retention. So if you're feeding lots of soft tinned mushy pate type food, this has a much bigger chance of sticking to the teeth and staying there, which is going to provide a growth, a growth medium for bacteria to work on, and also assist in plaque production. Some disease conditions, as I said, like diabetes, along with kidney disease and some diseases that suppress the immune system, can allow bacteria to take a bigger hold in the mouth, and you have an altered bacterial colony within the mouth that can be problematic. There's a suspicion, at least amongst scientists, that breeds like greyhounds and Maltese dogs may have a genetic predisposition to accumulating plaque more rapidly. There's probably more research that needs to happen, but definitely those breeds, in some studies, have shown that they have more aggressive and rapid onset forms of periodontal disease than other dogs. And sometimes your open mouth breathing type animals, definitely the ones with the shortened snouts that struggle to breathe through their nose. I guess Persian cats and bulldogs come back to mind. They are a potential higher risk category too. With regards to the disease process, bacteria initially, there's always bacteria present in the mouth, and they represent a normal colony in any mouth. So the mouth's not a sterile environment. Those bacteria, if they aren't interrupted and disturbed on a frequent basis, will attach to the teeth and form what's called a biofilm, or a sticky surface that then allows food to attach and a matrix to form that eventually creates plaque. That generally initially accumulates in the crevice created between the tooth and the gum, in the margin there, and this allows bacteria a safe haven to produce toxins and build colonies. In turn, the dog or cat's own immune system is switched on to fight that bacterial colony, and the inflammation results in further damage to the gum and the ligaments that hold the teeth in place, eventually leading to permanent damage and potential tooth loss. So the signs the signs to look out for with regards to dental disease, probably the most obvious one for pet owners is foul breath. Sometimes owners will notice an accumulation of plaque or calculus, which is a scale on the teeth. I guess we also sometimes see blood in saliva or excess saliva, sometimes ulcers in the dog or cat's mouth, and occasionally a lack of keenness to chew food normally. However, with lots of dogs and cats, for those symptoms to arise and be obvious to owners, by that stage the disease is well advanced, but much earlier than the symptoms actually appear. So by the time you're recognising those symptoms, potentially irreversible damage may have already happened. If the disease is identified, say at early gum inflammation stage, we can reverse the process, and probably our advice in more recent times is generally to get in and scale and polish those teeth, which gives us the best chance of returning the teeth and gums to near normal health as soon as possible. This involves a short anaesthetic and then a similar procedure to that performed by human dentists for routine dental care that humans receive. So they will generally scale and polish and scrape the teeth to tidy them up and remove any plaque from underneath the gum line. Once the teeth are freshly cleaned, prevention of rapid recurrence of plaque is then put in place with attempts at home care. So ideally, it doesn't actually ever get to the point of having moderate to advanced periodontal disease or even early periodontal disease. Ideally, in puppies, our focus should be, and pets with healthy teeth, should be to try and keep them healthy rather than trying to undo the damage once it's already started. General advice with regards to home care, home care is a procedure that owners can perform at home to retard the accumulation of plaque. Without this sort of home care on a regular basis, plaque may quickly form or reoccur. The main aim is daily removal of plaque. So once plaque becomes mineralised into calculus or a heavy plate on the tooth, home care is going to struggle to remove this heavy, well-attached plaque. The types of home care tools that most owners have access to in order to try and limit or provide daily removal of plaque. The gold standard that all of the specialist dentists recommend is daily toothbrushing. This may seem ludicrous or quite out there and puts our pet care into a high maintenance sort of category, but ultimately, if we didn't want to ever or wanted to minimise our risk of ever having dental issues in pets, daily brushing is a good idea, just the same as we brush daily or twice daily to try and keep our teeth healthy. The compliance that we see or the uptake that we see with clients completing this seems to be low, but I guess if it's commenced during a puppy or kittenhood, that's the ideal way to avoid accumulations, and without that sort of approach, accumulation of some plaque is inevitable. Using flavoured toothpaste may make things easier, may make pets accept the whole deal a little bit easier, and you can access things like regular human medium to hard sort of bristled toothbrushes are generally the most accepted ones. And you can use rotary sort of electric toothbrushes as well, or even most pet stores and vet clinics stock finger brushes, which you can just slip over the end of your finger and do the brushing with your finger. There are also antibacterial rinses, which have been proven to be of benefit, but again, it can be sometimes hard to get pets to be agreeable with that approach. The other things that we really heavily rely on, which may be more easily accepted amongst most pets, are things like the use of textured diets. Any food with a dental claim, so if you check your food packets and they are claiming to be good for dental, for plaque prevention or plaque management, for scrubbing and brushing teeth, they're good ones. Probably the best thing to do is, if you find something, check the brand and the type, and seek the advice of your vet to clarify whether they agree that it's a reputable sort of a product. The other thing that can be helpful, but probably doesn't provide quite as good a scrubbing effect as dental biscuits or dental kibbles, that there are quite a large range of dental chews and treats and rawhides and those sorts of things available on the market, and no doubt they have a helpful effect. I guess we rely more on dental biscuit and kibbles because in that way, every time your dog's having a feed, it's in effect having its teeth scrubbed to an extent, and so you're getting a much more regular daily or twice daily scrub rather than the occasional rawhide. Bones come under a little bit of a conjecture at this stage. Definitely, there's been trends towards use of bones, and then at times in history also trends away from their use. If the dog's copes with bones okay and has proven that its digestive tract and ability to digest bones has been reasonable, you can use them at your own discretion or peril. Definitely they're going to have, if the dog chews the bones properly, they're going to have a helpful effect on scrubbing the teeth. But some of the negative effects that we see from bones are things like effects on the digestive system, like potential for diarrhea or constipation. I guess worst case scenario, risk of causing a foreign body obstruction in the bowel and blocking the animal up. Also things like causing lacerations or getting lodged at the back of the throat. Occasionally we even see bones cause fractures to teeth just because they're so hard. Dogs can crack their teeth on bones. So again, we probably err more towards a really good reputable dental diet rather than the overuse of bones and those sorts of things. So I guess a couple of references that I've got, specifically one that's found in the British Veterinary Association Small Animal Dentistry Manual, says that they've investigated studies that showed that for dental home care to control plaque accumulation and gingivitis in dogs, the highest quality of evidence existed for toothbrushing, antibacterial rinses, and dental foods with a textural characteristics, along with proprietary dental treats and short-term use of rawhides and those sorts of things. So if you can do those sorts of things at home on a very regular basis, that minimises your risk of plaque accumulation. Then you minimise the need for overly regular intervention. I think if you don't brush your dog's teeth one way or another, there will come a time when plaque is recognised to be present on a dog or cat's teeth, and at that point, really early intervention is the best thing. So making sure that teeth are checked on annual health checks or annual vaccination checks with vets, making sure that they don't go multiple years without actually having their checkup is really important, because it gives the vet a chance to give you that advice as to how the teeth are going and whether or not intervention is required. That probably rolls up our general information on dentistry. Thanks for watching, and I hope that this has been informative for any audience that we have. If you'd like further information on this or any other subjects, please feel free and happy to contact us or to browse our website, which is at www.bunburyvets.com.au. Thanks very much, and have a great day.